Welcome to the Riverain Technologies booth. My name is Hundley. I'm Director of Channel Partnerships for Riverain Technologies. Today we're going to be discussing the emergence of lung cancer screening programs in Europe. We have three experts with us today. Juan Gutierrez from Bayer, Professor Thomas Frauenfelder from Switzerland, and then Dr. Gunnar Petersen from Bayer as well. So we'll start off. Gentlemen, if you could each just give us a little information about yourself, that would be great. Professor Frauenfelder?
Thank you. My name is Thomas Frauenfelder. I'm the chair of radiology at the University Hospital of Zurich, and I'm a chest radiologist, also co-founder and leading the national or starting the national program. We are now in the phase to discuss these issues with the government, and I'm also working together in the executive board of the European Society of Thoracic Imaging.
Thank you. Dr. Petersen?
Yeah, so I did my education in Heidelberg and started my work life over there as well. Later on switched to the University of Düsseldorf, and since 2018 I'm with Bayer, heading the radiology department in Germany, the medical affairs area.
Juan?
Of course, Alan. So also I'm a medical doctor from Chile. I'm originally from Chile, and I'm a thoracoabdominal radiologist. I got my training in Barcelona, Spain, where I worked there for a few years. And after that, almost 6 years ago, I jumped to Bayer, where today I'm the medical lead for digital radiology in Europe.
All right. And again, thank you for joining us today to talk about lung cancer screening in Europe. So as we know, in the United States, lung cancer screening has been formalized for many years, going on a decade now, but we're starting to see the emergence of lung cancer screening in regions all across the world, especially in Europe. So thankfully today we have three experts with us to talk about that. Dr. Petersen, with that, Germany is set to establish and formalize a lung cancer screening program in 2025, with low-dose CTs being introduced in July of 2024. So with that, can you provide an overview of where the market is right now and what's being done currently between that introduction of low-dose CT in 2024 and the go-live here in about 18 months from that point?
Yeah, so it's a really exciting time now, as we have this guidance, federal guidance that came out last July, and it said that lung cancer screening has to be implemented in Germany. So the whole program is completely new. Up to now, only patients that pay by themselves could get such screening. Mm-hmm. But to have a standardized system in Germany, that's completely new. And now there's a federal a group that is setting up the guidelines for the next year, and including all the whole setup, including the prices, everything, the reimbursement process. Mm-hmm. And this will take about 18 months. So we hope that by mid to end of next year, the whole process will be done. And what is new about it is that it's very standardized, that AI is included in the diagnosis. Okay. So we have the radiologist in a first step, in a second step the AI, and then depending on the classification, you have again another radiologist plus AI.
Okay, and again we'll be highlighting the use of chest AI further on in the presentation as well, and how that will be impactful to the program in Germany. Switching gears, Professor Frauenfelder, if you could you please give us some information around the state of low-dose CT and screening in Switzerland?
Well, we are a little bit in behind compared to Germany. We also started this process now. The whole economic system is a little bit behind. Epidemiology is now starting, and we just entered one draft into the health authorities now. We hope to get the first feedback in the first quarter of next year. So then I hope we can start. In Switzerland it's different. First of all, the national health authorities have to say yes to this new topic, but then the organization itself is given by the different cantons or regions, so this makes it more complicated because it's not a national-wide screening. It will then also be deployed by their own regions, and this may lead to a more different carpet of who does it, who doesn't it, like we now have for breast cancer screening.
Okay. So as you can see, there's a lot of activity in Europe around lung cancer screening, and a lot is going into formalizing these programs at a regional level in various countries. So with that's going to come challenges. So Dr. Gutierrez, Juan, as an expert in AI and in the AI sector yourself, what challenges do you foresee for the markets and what they're facing?
Okay, so I think that there are going to be many challenges. Because of time, I think one of the most important to mention is that, as we mentioned at the beginning, and my colleagues also mentioned, we're starting to see that there are starting to appear different lung cancer screening programs in different countries. We have the Germany example. We just heard that Switzerland is starting to go in that direction. We also have Italy. We also have France with the Cascade program, Spain with the Cassandra one. And the needs for these different programs are going to be different. They are not equally, it's not homogeneous around the continent, and we will need to understand what is going to be required from our side to support these programs, data management, CAD characterizations, or follow-up. It will depend and it will change. And for that we have multiple applications that have been developed in order to support this. I don't know how many CAD solutions we have in the market. Maybe 10, I don't know, and they are not all equal, and they don't all provide the same output. And it's important to understand this, because if you choose an application that is not the correct one for your needs, that's going to fail. Also related to this is that we need to be aware that we have a shortage of radiologists here in the US and also in Europe. The new lung cancer screening program in Germany is going to require approximately 5 million extra CTs per year. Who's going to do that, and how is that going to be done? AI probably will play a huge role there to support, to increase the productivity of the readings. Right. And last, I think it's education. I ended my training as a radiologist 7 years ago, and I received 0 training on AI. And it's really important to understand like the benefits of these solutions and the limitations, because at the end you need to understand how to use them properly to maximize the benefits for patients.
Right, and I think with that, you mentioned efficiency multiple times and read time reduction. With these lung cancer screening programs comes enhanced volume, right? The burden is going to be on the radiologist.
Agreed.
So how do we help reduce that burden, help the radiologists be more efficient as screening volumes and low-dose CT volumes are going to continue to rise on an annual basis in Europe? So with that, Professor Frauenfelder, you've authored many papers about nodule detection. Can you talk about your experience with AI tools specifically when it comes to nodule detection and addressing some of these challenges?
Well, what we see is that we have more sensitivity, we see much more, and what we always are facing in is what is our workflow and what is our need, because what is mentioned we will have in Switzerland, we don't have the 5 million, we will have 300,000 to 500,000 more CT scans just for the first round, but that will increase as it goes for the second or for the recall rate. And it's really for us important to fit this into the system, that it works closely, that we speed up, and also can have a reduction of the false positive one, because this is the one which makes us more worrisome, which makes more effort and needs also more energy behind in the line of the therapy, which goes to surgeon, which goes to the pulmonologist and the oncologist. So we want to keep them really on the other hand, we want to have quality assurance. This means who reads at which time, who's the first reader, is it now the radiologist or is it the AI? Maybe the AI could take it, but how can we convince that what AI tells us, right, or have we to change the situation? We are not yet really clear, and as heterogeneous like Switzerland is in the cantons, so heterogeneous we will also be in the systems we will use. But I think there is, between our authority, our university hospitals, there is some clear view where we want to go in terms of having efficient and high quality in one package.
Right, we're going to need to speed up the process and reduce the burden, as we've talked about, but also, most importantly, we need to ensure that clinical outcomes are not impacted, and if they are, it's in a positive manner. And as efficiency grows, we need to ensure that you're also very confident in the findings and the results provided by an AI tool like ClearRead CT by Riverain. So with that, Juan, can you speak a little bit about the orchestration process, going beyond a single algorithm, and what you're doing at Bayer around Calantic and the integration of tools like ClearRead CT? That'd be great, thank you. And how it could impact lung cancer screening, again, most importantly in Europe?
Well, regarding orchestration, I think we need to realized that we cannot continue working in silos. At the end, it's not only a CT, we have clinical data, so we need to integrate the health electronic record before and after the realization of the CT. And that, again, will change depending from country to country. So in some cases, we will require to provide support for the follow-up of the patients. So in that way, I think that the integration of the clinical data is important. And I think this is quite important because, as we mentioned, AI is, well, I think it's going to change significantly the way things are done. And I hope that in the upcoming years, we're going to see new publications demonstrating, prospective publications demonstrating how AI is going to reduce the workload for radiologists. As you mentioned before, we are already seeing this in other use cases where the use of AI is reducing almost 40% the workload of radiologists. So, well.
Right. No, and I think when you have these programs introduced that mandate the use of AI, you're bringing in another solution, another algorithm, and a solution or an orchestrator such as Calantic. You're able to run multiple algorithms addressing subspecialties at the same time and in the background to, again, address the efficiency concern that could come up.
Correct.
So with that, Dr. Petersen, can you speak a little bit more? I mentioned the mandate around AI specifically. So can you speak a little bit more about that in Germany and what some of those requirements are going to be in mandates around the new lung cancer screening program?
Yeah, first of all, I think it's very important that AI will no longer be just for special patients or for patients that pay themselves. By having this program, in the end, we'll be able to offer a lung cancer screening program to every patient aged 50 to 75 that has at least 25 years of smoking in the history or stopped within the last 10 years. So that's really great. But there's a lot of work we have to do. So like people have to identify the right patients, send them into this whole process. And then coming to the AI, the whole guidance that is set up now has clear ideas. It was set up by experts from the different areas, so not only radiologists, but as well thoracic surgeons were included, the societies were all included in this. And the tools have to provide special things. So, of course, it has to identify the nodules. It has to do volumetry. It has to be able to follow the volume over time, if you have other older pictures, for example. Then it has to give the radiologist a classification on what it is, what type of nodule is it. It is a solid, partly solid, ground glass, and what classification it has, as well as an advice on the potential malignancy, because this has direct effect on the next steps in the system. Sending the person to a specialized center for a second view, or sending them directly to a bigger center that is specialized for interdisciplinary conference. So that is very important. The tool has to offer that. It has to have a standardized protocol in the end. That is included in what it has to have. And it has to be a centralized data system.
Okay. So it sounds like a solution that needs to be comprehensive, touching multiple phases of the interpretation, from reducing workflow or reducing the burden on radiologists, improving efficiency, but also be confident that the outcomes or the volumetrics are provided for all nodule types, as well as a summary that can then get into an information system or a reporting system to again touch every phase of that journey for you as radiologists to again address the new lung cancer screening programs and the challenges that may come with that, with the rising volumes. So I'd like to thank all of you for joining today, our panelists. I appreciate you very much for joining us here at the Riverain Technologies booth.